You're tuned to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeart, and we are also podcast on Spreaker. This is the Patient Partners Show. I have my co-host Jeannie Roller with me on Skype from Indiana, and we're talking today again. We're going to continue to talk about informed consent because it's a huge deal. And it's one of those things where you're signing this paper and you're trusting. Your trust is like with a capital T, and you figure that your best interest is going to be served by whatever surgery or medical procedure that you're signing this informed consent for. And most often what we've found is it really isn't informed consent to the fact that you do get to say what you want and ask for what you want. They do tell you ask your questions, so we've done that. You know, all of us that talk on this show and all of us that are patient partners trying to figure this out. And then we find out in the end that none of that stuff really was going to happen, which we should have been told about. So we could have made another informed decision and said, hey, I'm not staying. I'm going to go somewhere else for a second or a third opinion or whatever we decided to do at that point. And then if you don't know that and you wake up in the horror of sexual assault, sexual medical assault, just trauma, PTSD, then you got to figure out the pieces on why it happened and why no one listened and what actually is informed consent. So we're going to talk about that some more today. And Jeannie Rolla is going to have a little example of what an informed consent paper actually says. And to me, I'm not a doctor, I'm not a lawyer. We say that all the time. It seems like there are an awful lot of loopholes that help the medical side, but not necessarily help the patient side. And that's what we're concerned with and what we're trying to change and what we're trying to talk about. So, Jeannie Roll, go ahead.
Well, remember last week we did talk about informed consent. Informed consent and the consent form can often be two different things because informed consent is usually a verbal conversation, which may or may not transfer to your consent form. In fact, I have never seen a consent form listing the things that you actually talked about in your informed consent discussion. Now, I have in front of me the consent form that was in my husband's file. If you remember, he did not see it. He did not ever sign it, but it was put in there. And it says, my doctor has given me information about my condition, the kind of procedure I'm going to have, what I can expect to happen during and after the procedure, risk and problems that could happen if I had the procedure, other things that I could do besides having this procedure. Now, this is on the consent form reminding you. Another area on this consent form is to be done by, and it leaves a blank where the person doing the procedure is supposed to fill it in, and below that signature it says, and or anyone else my doctor thinks is necessary. So you may have this discussion with your doctor saying that Dr. X is going to do your procedure, but when you go to wake up or you go and look at your consent form, you have found out that Dr. X actually let Dr. Y do your procedure. Right. So this is very, very tricky stuff. And then it also goes on to say, I understand, and this is what is called a blanket clause. I understand that I may need more or different procedures done if my doctor finds unexpected conditions happen while I'm having my procedure. I give permission for my doctor to do any other procedure if they feel are necessary for my health. My permission includes all the conditions that are not known when my procedure is started and need to be treated when they are found. So that is a blanket clause saying that while during the course of the procedure, the doctor has the right to do anything that they deem is necessary, even though they have not discussed it with you. It does not have to be life-threatening. This is a true blanket form.
Okay, so I'm going to stop there for a second and just be the devil's advocate, and I want to say, for the doctor's perspective, they cannot possibly know everything that's going to happen. There's just no way. I mean, we have to give them credit for that. The other thing is are there instances, so if you're going to a surgeon, you know, that's done this operation a couple of times, this procedure a couple of times, they kind of maybe know the lay of the land, which possibly could happen. I feel that should be told to the patient. Some doctors think that it's TMI, too much information, you know, that for their reasoning, I can't talk for them. I have some ideas on why they're not going to tell you that. Sometimes it's because they don't want to tell you it because they don't want you to leave. So, I mean, I get that there has to be a little bit of a leeway, but it can't be so much of a leeway and so much of an open clause that the patient really has no clue at all what's going to happen, and the patient just blindly signs this, because that's what's happening.
Well, and that's what's happening, especially to women.
Mm-hmm.
You go in for a cyst on your ovary, and maybe you're in your 30s, and maybe you had double cysts on your ovaries, and then you wake up and your ovaries have been removed, thus eliminating your chance of conceiving a child. So, this is very important that you know that this could happen. And that is something that needs to be disclosed, because that woman should have the right to say, no, leave my ovaries in. I want children. We'll discuss it. Close me. We'll discuss it afterwards.
Right. So I wonder, I was thinking that when you said that, Jeannie, why can't the doctor then at that point, is it money? Is it, drugs? Is, the I don't know, is it the perfect time then to do that? To just take that one cyst out and then wake the patient up and say, hey, listen, when I was in there, this is blah, 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 and let the person decide. I mean, unless they take a biopsy, and I know they can biopsy it really fast when you're on the operating room table, and say, okay, it's not cancerous, so we can close you up and deal with this later.
Right. And I don't know why doctors do it. I know of several women this has happened to, and they've been devastated by this. So this is very important. Some other things that this consent form says that are very troublesome is that it says, I agree to the taking and publication of photos or televising my operation, treatment, and our procedure for medical and scientific educational use. My identity will not be made known. I do not want my face to be shown in photographs or television. Well, this is on a consent form. This is in the fine print. This is usually not disclosed. Most people don't see it. Most people don't realize that a lot of procedures are filmed, and they do show them as roundtable discussions within the hospital, and then they take some of this to the medical conferences. And I've even seen people's faces on different medical magazines where they don't really cover up your face, or you have an identifying tattoo that they're showing. It says, I understand that moderate sedation may be used during my procedure to lower my anxiety or pain when I'm awake. But the thing is, it doesn't tell you who is going to administer it, what they are going to use. So the sedation thing needs to be explained beforehand and on a separate consent form. It needs to be, because just mentioning it as a passing thing in the small fine print is not acceptable.
It isn't. It isn't.
Also goes on to say, if my doctor thinks it is needed, I authorize any sales representatives or vendors to be at my procedure to advise my doctor or get technical support. This again is in the small print. Many people would object, but they don't have the opportunity because there's no way to remedy this. And then it goes on saying, since this is a teaching hospital, I will allow observers to be in the room while my procedure treatment is being done. I understand that students are being trained at the hospital, may help before, during, and after my treatment procedures. Again, this is in the small fine print. All hospitals nowadays label themselves as teaching hospitals as a way to attract medical students to stay. So, I mean, this is very tricky terminology. Again, they say since this is a teaching hospital, they are wording it so that you feel that you do not have the right to say no. So this is all, I mean, the way these forms are worded is very tricky. And then right before the signature, it says, I have read or have read to me and agree to all the above. My doctor has explained the proposed procedure operation to me, so I understand it, and I have all the information I need, including the risks, benefits, and alternatives. I have been able to ask my doctor any questions that I have about the procedure, so I understand and have all the information I need. So on the consent form.
And we have like 30 seconds left.
Okay, this consent form and otherwise voids any conversation that you had prior to this consent form. Just keep that in mind.
And the other thing is, real quick, the doctor isn't even the person that's giving you this consent form in most cases. It's a different person. It's not a doctor. And so it's, if you don't even have an appointment to talk with your doctor before surgery, none of this is going to be explained. I just want to say a huge thank you to Misty Roberts at patientmodesty.org. She's one of our patient partners. And Jeannie Roller on Twitter at writes4patients with the numeral 4. And I want to say stay tuned and keep listening to Planet Vero Radio. We'll be right back.